Hi everyone, Dr. Sean and Dr. Ty here. And again, what we're going to do is instruct you. This is the acute low back pain module. So if you've gotten this video, it means that we're just struggling with that low back and getting it moving very well. And these are some stretches that really help to gently mobilize that low back to get the fluids pumping, because most of the time it's hurting because the muscles are so tight. Our disc spaces, we might have degeneration in there. We might have some pinching going on. And so if we gently mobilize it, then all of a sudden we can free up some of that movement and it feels better, okay? Then we can get more stuff done later on correcting it, okay? So what we're gonna do is we're gonna start with the child's pose. Okay? Child's pose is just really nice to open up these low back muscles in there, and it's just going in on hands and knees, and then just slowly sitting back on your heels, opening up this part of your spine. And what you're doing is you're just relaxing. The biggest thing is we need to learn to relax those muscles. When we do any stretch, a lot of times we can fight that stretch and not even realize it. So you have to tell yourself, I'm gonna relax these muscles. It's good for your shoulders as well. It helps get those shoulders elevated and everything. But just holding this position for a good 30 seconds to 45 seconds is a really nice, just gentle relaxation to open up those muscles nice and easy. From this position, he's gonna go to all fours, hands and knees, and we're gonna do what's called the cat-cow. Most people have heard of this, but this is a good inhaling, exhaling exercise as well. We're gonna inhale when we go down, and we're gonna exhale when we go into that cat position. So relaxing that spine, and again, just letting it go, belly button to the floor, and then exhaling as we're pushing up. We're pushing all that air out. Inhaling in, and filling up those lungs with all that air. Notice his head too. He's tucking the head when he's going down. He's bringing it back up. Again, this is a full spine exercise to, again, just gently mobilize and get things pumping in there, okay? So this is a good one.
Sorry to interrupt, but
go ahead.
Sometimes if you need to, you can modify it by just doing small little tilts back and forth.
Perfect.
Maybe this is all you can do, and that's okay. We're just trying to get those joints moving, okay? Nice and easy.
Excellent. All right, so that's cat-cow. Third is gonna be a psoas stretch, okay? So now a lot of these posterior muscles here, we hit those a lot. We gotta also attack the anterior muscle structures. So I guess we will maybe do it on this. Fine, yeah, it'll work. So what Doc's gonna do is gonna get in, this is called the lunge position. And so it depends, and this might hurt that low back. So if it hurts the low back, that's okay. Don't worry about it, let's skip this one. Do what you can within reason. So what he's doing is he's stretching his right psoas right now. Okay, the psoas is the hip flexor muscle, and when that gets really tight, it cramps down and it jams the low back. And that's why the psoas is so important to be relaxed, okay? So you can see what he's doing, he's bringing that right arm up on the side of the psoas, and that just stretches this whole side out. If you feel this, where you should feel the stretch is gonna be in here, but also down your thigh, because you're stretching that quad muscle as well, okay? So as he switches to his left psoas muscle, left hip flexor, you can see it's just gonna open that whole side up, and he's lunging forward with it. So a good hold time is going to be, again, 30 to 45 seconds. We don't want to do these kinds of stretches before you work out, at holding any kind of stretch, I should say, for 30 to 45 seconds before you work out. Before workout stretches are like 10 seconds, maybe 15 seconds. And the reason why is we want to relax these muscles when we're stretching in a 10 to 15 second time frame. That gets our muscles ready to now go active. If we're doing 35 to 45 seconds, now we're elongating the muscles, and that puts the muscle in a different position. So if we go to work out or do some athletic event or something like that, now we have a chance that we can tear something, okay? So that's the difference in those stretching. So this is more, let's elongate those muscles, and you'll be able to tell from one side or the other which one's tighter, okay? What should we do about that? Well, let's stretch the tighter side longer. It's okay to imbalance your, change the time difference on stretching from one side to the other. And eventually what you want to see is, oh, now they feel the same. Okay, then you can bring your times into that same level. So those are the markers to be looking for. Okay, the next one's going to be just basic quad and hamstring stretch. So quad, hamstrings. There's the laying down hamstring stretch that's really easy. And again, with acute low backs, it'll be easier to do this one. We can go forward like this. Okay, nice easy stretch. And then the other way to do it, again, how long are we holding this? We're doing it for 30 to 45 seconds, okay? The other way is laying on his back. And then just having one knee bent, and then, yeah, just like that, okay? Now we're stretching this hammy out, and again, 30 to 45 seconds, each leg, going back and forth. Listen to your body. What side is tighter? Spend more time on that tighter side, because ultimately, if there is a tighter side, that's pulling on your pelvis, and that makes your pelvis shift out of alignment. The better these are more balanced muscles, then the better chance you have at having a better looking pelvis, and your adjustments hold longer, and so on and so forth. Now we're, again, correcting that spine. That's the whole goal. A good quad stretch is gonna be, yep, laying on his side, and you can put your arm all the way above your head to, again, kind of help accentuate the stretch. That's down in the ab area and the psoas area. And then we're not trying to crank the foot back or anything like that. We're just trying to get a nice gentle stretch in the quad area. And then same thing, we're gonna flip on the other side and do that. If it hurts your shoulder, then you can just position it however you want, whatever works best for you, okay? So same thing, that's what that looks like. Now we've hit the front and back sides, the psoas, the hammies, the back, and those are gonna help that back really settle down. If you want to, you can incorporate some glute stretches, and that's pulling your leg up and bringing it across, like we've showed you in different videos as well. And that is gonna really help to relax these muscles. And again, it'll tell your body a lot. This is oh yeah, figure 4 is a really good one too. So it's gonna tell your body a lot on what side is tighter, and we really wanna identify that, because that'll help us in the long run. Okay, so if you've gotten this module, you know this is something that's going to be important to really settle that acute low back. And we say acute, what that means is it's just really painful right now, and it's not something that has been going on that very long. Okay, so this is to settle that down. So do this, and then again, your warm-ups, your wobble, your neck traction is incredibly important. It'll make that a lot easier and more enjoyable as well. So with that said, Dr. Sean here, Dr. Ty, and be blessed and be a blessing.